person, and we are going to be discussing COVID-19, its effect on the older persons. And with me in studios, I have Orach John, who is the representative of non-government organizations on the National Council for Older Persons. Orach, you're most welcome to our studios.
Thank you, Mr. Grabo, and good morning. And I want to say good morning to all the older persons listening to this program and others who are not so well, not able to make it. Thank you.
You're most welcome. Then I also have a person in transit. He told me he's in 40-something there, though by appearance I couldn't believe, but that is the reality of the matter. That is Were Wataka Emmanuel Fred. Were, you're most welcome.
Thank you, sir. My name, Were Wataga Emmanuel Fred. Yes, as you noted, I'm in one of those groups which we don't, I'm not a youth, I'm not an old person. Actually, I need my rights to be fought for. I'm 44 years. I work with Uganda Reached Age Association as the head of programs, and I'm also happy to be in these studios. My greetings also to those people who have a heart for older persons, people who have a heart for persons with disability, generally people who have a heart for persons who are vulnerable in this country. My greetings to all of you, and join us together as we discuss this topic today.
I'll begin with Orach. Orach, when we talk about older persons, help our viewer to better understand the category of people we are referring to, because this will shape our discussion throughout.
Yeah, like you said in the introduction, an older person is a person who is 60 years and above, male or female. Provided you clock 60 and above, you are an older person. And this age is recognized by United Nations, and it is universal. So wherever you go on this planet Earth, 60 and above is an older person. And it is entrenched in our Ugandan constitution.
Let's look at COVID-19 affecting the elder persons, which we know science has proven that they are most vulnerable to COVID-19 than any other age group. Coming back to Uganda, you represent these people on that is a National Council for Older Persons. How has COVID affected this particular group of people?
First of all, allow me to send our sympathies and condolences to all the older persons who have succumbed to COVID-19.
That is now to families.
Families and the relatives and families of the people who have succumbed. There have been very many. In fact, Tanzania now is mourning a vice president. So a lot of... Now, when COVID came, information went around that it was targeting older persons. And news coming from developed countries like England, like Italy, and whatever, of the number of persons dying in older persons' homes, seemed to support that view. Now, that information was received with a bit of panic in Uganda. So older persons felt that COVID had come specifically to target them. Now, we want to dispel from the very beginning that notion that COVID is targeting older persons. As older persons, we are at a distinct disadvantage because we have a number of underlying health conditions. We are already suffering certain diseases which COVID takes advantage of, including, by the way, malaria, the common malaria. COVID takes advantage of this disease. Now, malaria, high blood pressure, diabetes, you name it. So older persons are at a distinct disadvantage, not that they're specifically targeted. As a result, a number of older persons fear going to hospitals for their normal medication. So that makes their health condition worse.
Why do they fear?
Because they think that you go to the hospital, you are going to contract it there.
So you're rather safe without going to the hospital?
Yeah, and then the campaign is be safe, stay home. Yeah. So we say, if I stay home, maybe I'm safer. But you need to take your drugs. You need to consult. When a new case of illness attacks you, you need to go to the hospital. You need to see the doctors. Then the information coming is interacting with the doctors. They might have got it from another patient. They will give it to you. And being an older person, once you get it, the chances of survival may be very slim, which is not necessarily true. Once we follow the procedures, We are in the studio now because we are social distancing and we removed our masks, we sanitized. Once we follow those procedures and we don't risk unnecessarily, we are just like anybody else as far as COVID is concerned. It is not targeting us, the older persons. Yeah? But once an older person dies, it seems easy to attribute it to COVID, even if it is on another disease. So we need to take our medications regularly. We need regular medical checkups. We need to obey the SOPs. And we need to live a life that makes it difficult for COVID to attack us.
To attack the older person.
As an older person.
Emmanuel,
Yes, please.
looking at now still the older persons, we know these are vulnerable people. Some are even outside employment, majority, because 60 is retirement age, majority out of employment. How have situations favored them at this time of COVID-19?
We know when you say that, how has it favored them? Not really that they have been favored. Just like if I could give a rejoinder to, he has mentioned the health part of the challenges that they have faced. But also, and as you've noted, that they are no longer in the active economic receiving end. So, economically, they have also been disfavored. One being that, remember, some of their children have lost jobs. They themselves also probably might have been among the first people to be laid off when when jobs now are not enough. So economically, they have suffered. They have also suffered socially. He mentioned a little bit where that they are being discriminated, that you're the ones bring this disease. But also socially, it has also come, historically we've been finding that you find parents, when they are scaring their children, probably the child has not eaten food or a child is misbehaving, say, I'm going to report, to tell the other old woman to eat you. So socially they have also been that kind of discriminated. Then also psychologically, because of, you've noted that like the fears they have, that if I go to hospital I might contract it. If I go among as many people, because now we are saying we should have social distance, psychologically they're used to being closer to people. So that also has affected them, which also has brought issues of some of them are being isolated now. And that isolation is what actually kills so many of our older persons.
Because we tell you, don't go to the village, you the youth, please don't go to the old people. Rather send them mobile money, talk to them using modern technology, maybe have a video chat, but do not physically get there.
Which also is a challenge, because technologically not all of them are up there. You'll find a few people like Mr. Raj, for them they can at least go on WhatsApp, they can, but these ones are only used to that phone, which is the okay, this is
the ordinary
push button.
Push button. And some of them even, I have my own aunt who I told her one time I wanted to buy for her and said, no, you leave me, my son, leave me alone. She's 85 years. She fears even a phone. So in terms of information, they were not also getting it. There's that gap. Then religiously, initially the churches were closed. And now, you know, as you grow old, a number of things that we usually catch up with is, one, the diseases, as he has mentioned, especially the non-communicable diseases. Now, apart from that, older persons at that time is when they want to go closer to God. And now also they were at first alienated from going to churches. Lately there's an opening, now they can go. But also when they're going there, you have to go using masks. The masks are very good to use, but not everyone knows how to use them. Some of them, because of already their underlying disease that they already have, they cannot, they can end up suffocating. They don't know how to use the masks. We had those challenges. So if you talk about being favored, actually, there's not been so much favor around that since COVID came in. Especially now when you see that economically they don't have any source of income, socially, and all those aspects. Yes, sir.
Orach, when we look at the situation now, how best can we ensure that these older persons, first and foremost, in case there is an eventuality that they fall sick, they contract COVID-19, they can access treatment very fast? How do we better their lives at such a time?
Thank you for asking that. You see, older persons, their major concerns are two, like Fred has said. The first one is health. The second one is income security in old age. And unfortunately, the majority of our older persons now suffer from the lack of both of them. The majority are in poor health. The majority have no income security in old age. Social protection is trying to address the second one. But on the question of health, we have a problem as older persons. First of all, we don't have the medical personnel who are professionals in that field. The doctors are called geriatricians. The nurses and the attendant health workers are called geriatric professionals. We don't have them. I think in this country, I think we probably have only 2 geriatricians for a population of 2 million plus. And then we don't even have a single older person's ward in any hospital in this country, a geriatric ward. All the other age groups have got their various wards.
You have the pediatric.
Yes, the maternity wards, you name it, they're there. Even for Butabika, for the mentally, there's also a ward. But for older persons, there's not a single one. Even the new hospitals coming up don't make provision for a ward for the older persons. So we need a lot of review. This is one of the things the National Council is trying to work out with National Council for Higher Education.
Maybe it's attributed to our culture that for us, older persons, we stay with them. The whites will have
the older persons'
homes, yes, and all that. Yeah. But for us, we as a society, as a culture, we stay, we mix with them. We don't isolate them. We don't give them that specific way of handling that could seemingly be like isolating or discriminative.
That was true in the past. It's rapidly collapsing. The social cohesion, the community life which took care of the older persons is rapidly changing and collapsing. Now you find a lot of older persons on their own. And as Fred mentions, isolation leads to depression. Depression leads to death. So we are losing a lot of people because they are alone. There's nobody to talk to. There is nothing like that beats talking to an older person, putting a smile on their face, making them feel that they belong. But when there is no person to talk to, the young people have all gone to migrate, urban migration, the course of modernization. All these are taking a toll on the community system, which we used to enjoy, which older persons used to enjoy. Now they are not there. So that is something we need to reverse, that trend. We need to, what we call intergenerational dialogue, have a dialogue with the other members of the community. How do we bring the unit, the family unit, the community unit back so that older persons get integrated once again into that society and they can be taken care of? You know? The young people, where is living that group, they go to towns, they produce children, they send them to the Jaja in the village. That Jaja is already burdened with no source of income. But the children are sent there and the Jaja never says no to her grandchildren. And these young people, after taking the children, they don't help the Jajas. The next time they appear is to bring another child. So that sort of trend needs to be reversed. So that is on the health issue. But fortunately, the minimum health care package is trying to address some of the concerns, like lack of drugs. The majority of people live, older persons are in the villages. Their health center is the health center too. You cannot get their drugs for diabetes, for blood pressure, for these common ailments of older persons. Most of them are in health center force at the district headquarters, a long distance away. But they don't have the money for going to there, to the hospitals. Then the doctors, like I said, they are not there. The general ones who treat us do not come to health center too. We have clinical officers, just nurses. Some of them, because of their attitude towards older persons, you wait there. Now an older person, how long can that person wait in a queue to get attention? Then in the end you get Panadol for a complicated disease. Will you go back to that health thought? So I would rather just stay home and suffer. So we are losing a lot of older persons because of limited medical attention and access to the appropriate drugs. The minimum health care package is supposed to address that. But until these drugs get to health center twos, until the doctors get down to that level, or until there is good referral system so that an older person at health center 2 can be referred upwards towards health center 4, where he or she can access these drugs. But until that person is also empowered to be able to reach the health center 4, that is when the health problems will be addressed. Now on the income scene, we have mentioned the majority were in the informal sector. No pensions, no medical insurance. So how do they survive? We have a scheme here, the Senior Citizens Grant, which the government introduced in 2010. A very useful system. Some people, have, by the way, have criticized that. But why do you give these old people money to go and drink or to marry another woman? Not knowing that this is the lifeline. Hmm? And then others have said, what can 25,000 do? But if you can't make a single shilling in a day, and at the end of the month somebody gives you 20,000, and it is regular, and you know next month it is going to come. Now that 20,000, 25,000, which some people criticize, has changed the life of so many older persons.
Oh, that is a credit.
Yes, it has changed the lives of the communities in which these older persons live. Analyses have been done, and it shows that where this money is paid, the economy, the local economy there grows by up to 30%. On the day they are paying the older persons, there's a beehive of activity in that community.
One is buying meat, one is
exactly.
buying sugar.
Once in a while you can eat meat, at least even if it is once a month. At least you have changed your diet. You have the sugar, you have the salt, you have the paraffin, and even the box of matches. You don't have to go looking for
basics
fire.
for
life. Exactly. That's what they
salt,
need.
Sugar, paraffin,
Yes.
a matchbox.
Yeah.
Then they are done.
Then you're done. You go to the garden, you pick your fruit, your leaves there. And it is very healthy food, by the way. That's what we are trying to encourage. Healthy eating. Going back to vegetables. Meat is not the best thing. It is in fact killing people. But the vegetables and what not, which you can grow in your garden, provided you have the salt. You are done. You harvest your crops. So our only problem as older persons, as council, as people working with older persons is that age of 80. How many Ugandans live to be 80? You mentioned the life expectancy at the beginning. It's 64. So actually majority of older persons are on bonus. And they should be appreciated for having lived that long and having contributed to the economic growth of this country from the day they became of working age. And 60, they are still working. Yeah? So the entry age of 80, government's position, of course, is that because of limited resources, it is better to pay everybody than pay a few. But to be able to pay all the other persons, when they worked out the figures.
Statistically, what is the figure when you talk about older persons in this country, an estimate?
Well, the last census, 2014, we were supposed to be 1.43 million. Then the household surveys that are done every year by UBOS has raised that figure to 1.7. But for us, we know that we must be at least 2 million plus. Only that, a number of people did not register. And these statistics, even nearer now, we have a number of older persons who don't hold national ID because they didn't register. First, they thought, what's the point? All these brothers are going to get an ID. I'm not going anywhere. I'm in my village here. What do I need an ID for? So the majority took that view and did not register. But now it is a requirement to get that
money.
Yeah, get that money. Yeah, you must have a national ID. That is one requirement. To register a SIM card, you must have an ID. In some hospitals now, to get treatment, you must have an ID. So as older persons, we are encouraging our contemporaries, please make sure you have the ID. Yeah? That way we will now have an exact figure of how many older persons there are. As of now, it is just estimates. But we think we are 3.4% thereabouts.
Okay.
Yeah.
Coming back to Fred, when we look at COVID-19, you work with, that is Uganda Reach the Age Association.
Yes.
Let's better understand, has government addressed the issues because of this very vulnerable group? Are there specific programs that have come up to target the older persons in the fight against COVID-19?
Yeah, I'm going to talk from two arms. Probably not very able to talk for the government, but one, I know the government set up a task force which has been now working on issues of COVID-19. And in every district, at least, there's the RDC is the chair of that kind of task force. And there is good work that they are preaching the gospel of how the standard operating procedures as laid down by the Ministry of Health, and that's working well. There's also promotion of proper hand washing or hygiene. Now, I can ably talk more about the NGOs. And in the fraternity of those who are working with older persons, all of us who are organized under the network of Helpage International, because Helpage International is one of the global organizations that works with older person associations in different parts of the world. Now, particularly for Uganda, Helpage International has 4 partners. One partner is the Reach One, Touch One Ministries, who are engaged in geriatric medicine, or they have a hospital for older persons. And they have done a good work of preaching the gospel of proper standard operating procedures, helping older persons to really protect themselves from this health pandemic. Similarly, we have Health Nest Uganda, which is in Entebbe here. They are also preaching the gospel of how older persons can keep themselves safe in this period. They have also provided for them some facilities to see that they are safe, like masks and things like that. And then also we have Grandmothers Consortium, which is basically at the helm of advocacy, specifically for grandmothers in this country. And then Uganda Reach the Age Association, together with the Helpage, we have also been running some projects with support from the Start Fund. Now, what we were running was a project in the names of inclusive COVID-19 response to older persons, persons with disability, and other vulnerable persons. In this project, we looked at providing wash facilities and also providing the protection aspects for the older persons. Under the wash, we worked with 5 districts. That is Nebi, Jumani, Gulu, Abim, and Nakapiripirit. In those districts, we sat with them and said, okay, from our NGOs, we want to complement the work of government. How can we support the government? And one of the areas we identified was to provide wash facilities at high congregating areas. These high congregating areas came out to be like churches. When we talk about churches, Catholic churches, the Protestant churches, the Pentecostals, Seventh Day. Then also we looked at the Muslim, meaning the mosques, and then also cultural centers, like in Gulu worked with the cultural centers, because these were seen to be high congregating areas. As I mentioned earlier, older persons, as they grow older, it's either health or they are now seeking to be in good terms with God. So most older persons go to church. And so we designed that project, and we provided the 125 facilities to 5 districts, meaning 25 per district. Hand washing facilities, the tanks, the wash basins, then also liquid soap, as well as the temperature guns to help in checking the temperatures. But also we've been engaging in media campaigns through TV, but also through radios. We had to work with radios in those different districts to preach this gospel of the standard operating procedures. For example, one of the areas that I could touch in, you'll find, Mr. Moderator, that in this country, people even up to 80 years did not know how to wash their hands. You must have seen this, that when you go in some places, the wash facilities, you find people have mixed the soap and the water. And then now when the tap is opened, they wash hands with the water, and which is mixed with
soap.
And that is very dangerous. You still keep the bacteria in your hands. I don't know, even probably you might find that for it is new information today. The proper way of washing hands is whenever you go to a facility, wet your hands first, then you get the soap, clean all the different corners of your hands, and then rinse for at least 20 minutes with running water. People did not know that. And for the first time, the people are just learning that.
Wet your hands first?
Wet your hands first, then apply the soap, clean the different corners of your hands, and then rinse with running water for at least 20 seconds. At least 20 seconds, even more. But people have been mixing soap, and even in the very established places, established offices, you find they have mixed the soap, and which is very dangerous. So some of those things are things we have also been trying to preach. And we are grateful that this is now working in those 5 districts, and there's some change. Some of the centers that we actually identified, like churches, you remember the churches had just been released recently to start operating. First we started with 70 people, now 200 people. And one of the requirements was for them to have wash facilities. And they did not have. Some were just having 5-liter jerry cans, and the very dirty soap there is put somewhere there. So these facilities have really had an impact in those. So that's what, like NGOs, we are trying to do. Many others are also there, and then also, yes, I forget, we also provided masks to older persons, at least 2 masks. The 2 masks that you can wash one and use the other, like that. Because we found out that also people buying even just a mask of 1,000 was a big challenge. So that's what we also been trying to do as NGOs. But we're also grateful for the government in what they have been doing. Yeah. In addition to
maybe I can just add a little.
Yes, all right.
Starting, for instance, with the masks. You know, a number of older persons have difficulties in breathing.
Yes.
And when you put on a mask for a long time, the air inside there now affects your breathing system. So what older persons are encouraged to do is, after some time of wearing a mask, isolate yourself. Yes. Remove the mask, so that you can breathe at least properly for some time. Then if you must go back into a place where you have to wear a mask, then do so. But give yourself time to breathe without a mask because of the breathing problems. Now the other thing, of course, with older persons, particularly during generally, is sitting in one place for a very long time. Yeah. The recommended time is maximum of 3 hours. After 3 hours, get up, stretch the legs, move about. And they are saying when you start aging, it starts from the feet. So, and yet the feet is the one that carries all this body weight. Now, if the feet get weak and you're not strengthening them, then the rest of the body gets affected. So moving around, walking, gardening is a very important activity for older persons. So this is one of the campaigns that has been going on among older to increase the chances of an older person having a better life. Now, to add to what Fred said, government through the Ministry of Gender also issued specific guidelines for COVID response among older persons.
Oh.
Yes, the Ministry of Gender did that. And then
specifically for older persons?
Specifically for older persons, yeah. So that one is available to guide older persons.
But how do, you know, Orach, most of the older persons are in remote places.
Yes.
So they have always had very good policies, very good initiatives for the older persons. But the challenge has been this trickling down to the older persons. Now you're talking about specific guidelines for older persons.
Yes.
I want to believe my grandfather in Kasoga Kakuto literally even could get any access to this.
That is changing. Because now even in Kakuto, where your grandfather is, there is a district executive committee of older persons at the village level. We have these structures that now exist under the National Council for Older Persons. Our problem had been dissemination of information. There could be information.
How have you solved that? For example, the village where I come from, yes, you have a representative of the older persons, and like any other LC. But some of these positions seem just to
They are not there in name. That's what you're trying to say. Seem to be there in name.
Yes, you look for now who has come up and he's elected, she's elected.
Yeah.
But just there.
Yeah. It is changing. You see, the problem had been, you elect them, but they are not empowered. They don't have the means of carrying out some of their activities.
So why is
even at the basic level? But the National Council, working together with the Ministry of Gender, has now got a grant. Yeah, 5% of the grant that is sent to the district councils, 5% goes to older persons councils. It started last year. So at least now older persons councils are going to have some funds with which to operate. So the National Council, once we get information like this from Ministry of Gender, it is our duty to make sure it percolates and goes down up to the village council. So the village people get to know this info and get to know what to do. For instance, one of our activities which we are mentioning is, you know, this health we are talking about, as they say, health is made at home. It is only repaired in hospitals. These older persons can do a lot for their own health, yeah, rather than just sitting in one place because where do I go, what can I do, and getting weaker. There's a lot they can do. So we are trying to change what we call healthy living in old age. Yeah, every village is going to be empowered so that the older persons in that village can come together, maybe do collective exercises, maybe just socialize. Social life is so important, but our older persons are restricted to funerals, you know, burials,
some few weddings.
A few weddings here and there, like he said earlier, churches, and that's it. Even at the weddings, you are told where to sit. After a while, when the good things start, hey, Mukade, your time is up, why don't you now go home and let the rest now start the enjoyment? As if they are not entitled to any enjoyment.
They had it during their times.
Exactly. So these are some of the things we have to change. These older persons are part of society. Actually, without older persons, where would the other generations come from? They wouldn't be there. Yeah. So we must give them their due respect. Yeah. And I'm glad, we haven't mentioned it yet, I'm glad that government is now coming up with an older persons bill, a bill to protect and promote the rights of older persons. Cabinet has approved the principles. I think the draft is even now ready to go back to cabinet for approval. After that, it will go to parliament. Now it is time for us to start appealing to parliament. When this bill comes up to parliament, please expedite its processing and delivering so that it becomes law.
All right, recently you now have members of parliament representing older persons.
Yes.
Do you think this in any way is going to change the lives of older persons, or it's also merely a slot that has been slated there for you just under affirmative action and looking at the vulnerability of older persons?
You know, that argument of just another 5 people being added has been advanced so much.
Because I'll tell you, a big percentage of parliament are older persons.
Yes.
Big percentage of them, cabinet, but older persons.
But representing who and on what mandate? That's the issue. You see, when the special interest groups were formed and entrenched in the 1995 Constitution, all of them, except older persons were left out. We don't know why. The youth are there, the women are there, people with disabilities are there, the workers, the army, all that, they are in the Constitution, the 1995 Constitution. This Constitution was drawn up when older persons were there. Why older persons were not included is something we have never understood. Now, when council came, the National Council for Older Persons, you might also be interested to know that the women and the youth had their councils in 1993. The people with disabilities had their council in 2006. Older persons got theirs in 2016. 20-something years after the others. Now, why the discrimination? And all those are in parliament, except older persons. So we are asking, where is the fairness? Where is the equality? Where is the non-discrimination? Why are the others there and not older persons? And yet in the constitution they are all equal, special interest groups. So we started asking. Then you look at it. These older persons you are talking about who is in parliament, we can name them. There are very many. But whose mandate are they on?
Are they representing?
Who are they representing? Whom do they report to? They don't report to older persons. They are not accountable.
We just think they understand issues of older persons better.
Maybe they don't.
Therefore can push for them because they are in that very age group.
Maybe they don't even understand. Let me give you an example. The Older Persons Act, which formed the National Council for Older Persons, came into force in 2013. When we went to the Parliamentary Committee on Gender to talk about the rights of the council, and none of them had seen that act. And there were older persons there. They had not seen it. Some of them are not even interested. So now, when you look at the constitution, it allows for the rights of older persons. The UN Charter allows for the rights of older persons. The African Union Charter allows for older persons to elect their own representatives who are accountable to them. Yeah? And whom we can hold accountable. So we pressed through the Equal Opportunities Commission, through Parliament, where are our people who speak for us? Those people who are there don't speak for us. They are not accountable for us. Until finally we got these 5 slots. We have elected our MPs elect. They will go into the next Parliament. Those ones we can hold accountable.
Yeah.
If they don't do what they should do for the older persons, we can even recall them, which we can't do for the other people. So now we have a voice in Parliament, or at least we are going to have in the next Parliament. And as you know, older persons are the voice of reason. We have the hindsight. We have seen it all. We have that advantage, which the other groups don't have.
Well, this is where I'll bring in a semi-older person here, that is Fred. Fred, how best can we protect older persons against COVID-19? We've seen the challenges, we've seen what government has done, and now we are looking at how best can we protect the older persons, knowing that they are most vulnerable when it comes to COVID-19. I've been looking at some of our research done that shows how COVID-19 affects various groups, and you find that when it comes to older persons, many of them would end up, their chances of ending up in intensive care are almost 8 out of every 10.
Yes. Yeah. COVID being a health-related challenge, one is whoever is around the older persons, it's your duties, because sometimes the older person may not have all the resources, may not have even the ability, and sometimes because of the disease that they have, they may not have the strength to fight for themselves. You also have a role to see that an older person is protected. If an older person requires to be assisted to go and access his or her medical services, it would be good that you support them. And this goes to the children, it goes to those who are around these older persons. But also for older persons themselves, we're talking about issues of ensuring that you clean your hands properly. I know sometimes you are so busy looking after the vulnerable children around you, because statistically 60 to 70% of the vulnerable OVCs are actually under the care of the older persons. So many times they compromise their own health towards looking after. And you know, when you talk about the OVCs, it includes even those who are either infected or affected with HIV/AIDS. Now, the older person, put your life also at the forefront. See that you protect yourself. Where you are required to have social distances, please keep that social distance. And understand it. It's just for your own safety. Use of the mask, as you have said, whenever you are alone, you might not need to use the mask. But when you're in public, at least have a mask and see that it is a clean mask. Washing it might require some detergent, but there are different ways you can see that you get some detergent to wash your mask. Also, ensure that you adhere to your medication, because those who are already taking medication, remember COVID rides on top of the disease that you already have.
The comorbidity.
Yes. So ensure that you go for your drugs, ensure that you take them in time, ensure that you keep a good diet. Older persons' lives are not so much complicated that many times they need the sugar or they need the meat. Once in a while they might need it, but take those greens, take the lemon that is around you, take the oranges around you. That will help you to protect you. So it goes, and then the government, it has a role. As he has mentioned, the drugs that are supporting older persons, especially with non-communicable disease, they are at health centers which are far off. Can we see that they are brought closer? Can we see that, let's say in the medical profession, that they reach a point of allowing even health center trees to now administer these drugs? They have their reasons why, but because of the fact that an older person has to move longer distances, can we bring these drugs closer by? The services that are supposed to reach the older persons, because older persons, sometimes they can access these services which are far if they have the resources like the money. When you talk about the social assistance grant for empowerment, we are requesting that, yes, thank you so much, you're giving now, there's a national rollout, you're giving 8 years and above, but that age can go down. In my view, just 2% of the national budget can be able to support our older persons. It's just a matter of priorities. These older persons are the people who created this, who helped this country to be where it is. But we treat them like, have you seen these cars which make roads? They come, they make the road. Once the road is very beautiful, they get a wheel loader and put that car that, are you who made this good road? You will spoil the road. Go back to the stores. Let's not treat older persons like people who should just be taken back to the stores. Instead, and that's why you find even young people telling you, why are you in town? Go back to the village.
You should be in the village. What are you doing?
The older person has a right to be where they are. And sometimes they have constructed this house which you want to take over. Yeah? So then he has also mentioned the issue of this dumping children. You just give birth and the only time you are seen near your old parent is when you are taking a new child. Can we take responsibilities as the young people that we are to also facilitate, provide some money, ensure that they have a meal, ensure that they have the basics. Visit them. Older persons, what we've noticed, what is killing them is that isolation. Can you visit them? Can you encourage them? Then older persons, so we encourage you. If you know another older person in your community, sometimes you can organize yourself as a group. Probably not a group that is, let's say, going to benefit from some economic. It could just be a group for psychosocial support. You come together, you sit, you talk about the old things, you put some music of the old days. Those who can dance can dance. I tell you that can increase the life of an older person to another, like 2 years. If you're supposed to, it can increase at least 2 years. You know, one time I'd organized a meeting somewhere in Namaingo. We're just having a meeting with a few older persons. Then there was an old man who was on the way going to hospital. Then he heard that there were some old people sitting somewhere. He came and sat with us. We discussed. We had just some small meal. The man forgot to go to hospital, and he actually felt he was fine. He was cured just talking with other older persons. That's psychosocial support. Can we encourage it? Today we can have a meeting at Muzei Orachi's place. Tomorrow we go to Muzei Were's place. And like that, we just move around and just talking, just those few minutes can increase their life. So the government has its role, the community has its role. We're also telling the children, you know, it is very embarrassing to find that 2 parents give birth to 12 children. They look after them. They take them to school. But when these 12 children are old, they cannot look after these 2. And sometimes even by the time they are old enough, there's only 1 parent remaining. You can't look after that 1 parent, the 12 of you. It's a shame. Yeah.
Could I just add something very briefly to what Fred said? One of the things that we neglect is regular testing and medical checkups. And in this COVID situation, unfortunately, the tests
that Ugandans usually go to hospital only when they are sick.
Yes.
If someone is okay, then there is no need to go to hospital.
Need to go to hospital.
But also let's look at the cost element, more so now for the age group we are talking about.
Now we are talking about COVID-19. The test is so costly.
Yes.
And yet you need to know your status.
Regularly, the earlier the better.
Yes. So that alone it may be a cause of some deaths because people don't know that they are infected. So, but generally, regular medical checkups and testing should be a routine. Now, earlier I mentioned a group in Entebbe called HENO. HENO has organized older persons communities. Every month, they use a retired nurse to conduct some simple tests like blood pressure and that thing. And that thing is very useful. So we are trying to encourage older persons groups wherever they are. But don't wait for groups. Make sure you undergo medical checks where
and
they are
these services freely of charge in government facilities?
Yes, they are supposed to be free.
Are they or are they aren't?
They are supposed to be, and I'm using that word very carefully. They are supposed to be free. But you see the time you take to get there, the amount of respect you get, the being ignored, for instance, the attitude of the health workers towards older persons. Sometimes they don't make the services free. You have to cut corners somehow to get attention.
So they remain supposed?
It's supposed.
Okay. Well, we can take the whole day discussing issues of older persons because we believe it is just a cycle. That one time God giving you life, you'll get there. But you want to get there when it is as comfortable as you expected, so that you age with dignity. We are in the times of COVID-19, and many older persons are suffering because first and foremost, they're the most vulnerable group when it comes to COVID-19. But also sometimes situations don't favor them. Time is not so much on my side. I'll just give each one of you 1 minute to wind up, beginning with the semi-older person.
Yeah.
Yes, Were.
Yeah, first I'm grateful to the government which has put the relevant enabling environment for organizations like us to operate. Yes, we've done a lot of work together with you, coming from all the policies, because Uganda Rich Age Association stands, is into policy advocacy for older persons. And we've done many policies together with the government. Talk about the National Council for Older Persons policies, the regulations, and even the bill, this process of the bill. We are grateful also to our partners, HelpAge International, who give us the strength that we have, and also other NGOs which are working with older persons. We still have a lot of work to do. Let's continue. It's not the last lap, but let's run faster. There are very few organizations that work with older persons because, as you have noted, even resources for older persons are very limited. So very few donors. Donors who are there, we are calling upon you, support these organizations to support the older persons. I also want to talk to the older person associations, some of whom are even members of URA and others, that we have a work to do, continue supporting the older persons. I go back to the youth. Those of you who are giving birth to children and just sending them to the older persons, you have a responsibility to look after your parents in terms of ensuring that, yes, you take the grandchildren there. Older persons will never chase the grandchildren, they want them, but support them. COVID-19 is here. It doesn't discriminate whether you are young, you are old, you are a person with disability. Let's all be careful. Keep the social distance. Wash your hands regularly. Ensure that you have a mask. All of us, let's work towards seeing that the older person is protected, but also, in totality, all the persons of Uganda. I'm grateful to all. God bless you.
Finally, Muzeyi Orach.
Yeah, thank you very much. To my fellow older persons, COVID-19 is real. COVID-19 is serious. Please be safe. Follow the SOPs. Do your regular medical checkups. Take your medicines if you are on medication for any particular illness. Don't ignore. But like the government says, if you don't need to go out, don't go out. If you go out, please wear a mask. Now to the rest of the community, I want to give just one simple example. One time I was discussing with a group of younger persons, and I said in our constitution, there is section 34, which mandates an older person, any parent, to look after their children. It is in the constitution. And if the parent fails, the children can sue that parent. Then I asked the question, where is the reciprocal law which allows the older person to sue their children in case the children ignore them? And the children said, oh, I was not responsible for being born by you. So it is your responsibility, not the other way around. I want these children, please think, one day you yourself are going to get old. You will be in that position now where your parents are, where you will need all the help you can get. So start preparing by helping your parents. Thank you.
And I'll conclude with that. Do to others what you want to be done unto you. Have a lovely day. God bless you. Till tomorrow. It has been Good Morning Uganda Extra.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.